Hi, I'm Dr. Charles Schor from the Acoaxet Veterinary Clinic. Today we're going to talk about the concept of the dental ATP. ATP stands for Assessment, Treatment, and Prevention. When we go to the dentist, we go for a true prophylaxis visit, which means preventative care. And that assumes that we are brushing our teeth and flossing our teeth. Unfortunately, most of our patients don't get their teeth brushed as often as they should be, and certainly don't floss. So our visits entail something more than usually just cleaning, but we don't really know what we're going to have to do until we can get into the pet's mouth under anesthesia. Also, unlike us, pets require general anesthesia for an adequate dental assessment and treatment and cleaning prevention care visit. First of all, we must choose the right patient, which means that we must properly assess them prior to general anesthesia with a good comprehensive physical examination that looks at their mouth, obviously, but also looks at the pet as a whole. We listen to their heart and lungs, we palpate the abdomen to make sure that there's no pain or swelling, feel the abdominal organs, check the lymph nodes, check the temperature. So part of a comprehensive physical exam prior to any anesthetic episode is making sure that everything is healthy. Ears and eyes are clear. When we look at the face, we're looking for symmetry of the face and make sure that there's no swellings. We'll examine the teeth and gum line. She has a considerable amount of tartar. There's some gingivitis here. Oh, she's got a broken tooth right here. So her upper canine tooth snapped right off. Very good, normal temp. Okay. I'm going to give her a little pre-medication at this point. And this helps to decrease, That helps to decrease the total amount of general anesthetic that we have to administer to maintain her anesthesia, which is safer for her. And also helps to control any pain. Okay, Molly's ready. We'll lower her down. After our comprehensive physical examination is completed, any necessary blood testing based on our physical findings and the patient's age will be done. We want to ensure that the organs necessary to handle the anesthetic agent safely are working fine, such as the kidney and the liver function. So a blood test will be pulled from your pet, and we will run that laboratory results, make sure that the pet is in the best physical shape and metabolic state to handle a general anesthetic episode. And then our anesthesia regimen will be tailored for that specific pet based on what we plan to do, the comprehensive physical exam findings, and our laboratory testing. We want to protect the airway with an endotracheal tube so that fluids and materials from the teeth cleaning process don't go down the airway. And it allows us to do a proper thorough job because most of our dental disease is below the gum line. 60% of their teeth are below the gum line, as is the dental disease process. And we cannot fully evaluate what we're going to need to do and treat that appropriately without a general anesthetic episode to allow us to access the mouth in all areas, evaluate all areas both above and below the gum line. Okay, so our patient is under general anesthesia now. We have an endotracheal tube in place where her gas anesthesia is being administered, and this also protects her airway so that she doesn't get any fluid or debris down her airway into her lungs. We have she's under anesthesia with anesthetic monitoring here, so we have our EKG, our CO2 level, our respiratory rate, our body temperature, blood pressure being monitored. And so now we're going to go through and clean her teeth to start with. She has a moderate amount of dental tartar and a moderate amount of gingival irritation, gingivitis on this side. So we're going to clean these teeth first and assess them. We will now evaluate the mouth. We will scale and clean the teeth. We will probe, just like the dentist does with us, takes the periodontal probe going under the gum line, checking on a tooth-by-tooth basis, evaluating each tooth individually. The patient will then be charted. A dental chart for each patient is made, and therefore we can record our findings so that then, if we have to do any treatments and we need to follow that up at a later date, we have something to compare it to, or a medical record. After the cleaning and charting process, dental x-rays are taken, usually 75% of the time, even though we see no problems above the gum line. When we x-ray the teeth, which are 60% of the tooth below the gum line, we will usually find something abnormal on radiographs that we did not pick up on our initial oral examination. So dental x-rays are very important. So we're now going to do dental charting, where we're going to probe each tooth, tooth by tooth, and record our results. Based on our comprehensive physical examination of the mouth, both before and under anesthesia, dental scaling and polishing, charting, and x-rays, then a treatment plan will be based upon our findings, and any further treatments other than cleaning decided on the case-by-case basis, depending on what our findings are. So what we found here is that this tooth is fractured, will need to be extracted. It's broken below the gum line. So first we're going to give a dental nerve block, a local anesthetic nerve block, to minimize any discomfort intraoperatively as well as postoperatively. Okay, so under anesthesia here, we found that Molly has a fractured canine tooth which will need to be extracted. She has a little periodontal disease between her lower mandibular incisor teeth, and we can clean the pockets out and put a doxycycline antibiotic gel in the pocket to help save those. On her maxillary left last molar tooth, unfortunately there's severe periodontal disease with over 50% bone loss, so there's no salvaging that tooth, and it's better off extracting that as well. Okay, so we'll take care of that now, but she's doing well under anesthesia. Okay, we'll talk to you later. Bye-bye. Okay. All right. And that's our canine tooth right there. You can see how big that root is. The root actually makes up 60% of the length of the tooth. That's why, if possible, we try to save those. But this one, unfortunately, was broken too badly below the gum line to be salvaged. Okay. We're putting a little bone graft material in here to replace where the root was, and that will help us to maintain the bone contour of the upper lip to minimize it caving in, the upper lip caving in now that it's missing the canine tooth. So after we've ultrasonically scaled, hand scaled, x-rayed, performed our treatments, our last step here is to polish. And polishing, when we clean the teeth with the ultrasonics and hand scalers, it creates micro etching of the enamel, and the polish smooths all that micro etching so there's no plaque retentive areas left. Okay, so after our scaling and polishing, our teeth both above and below the gum lines are now clean. The broken tooth, the abscess tooth, were removed. We had pocket treatment on one of the lower incisors to maintain that. And our last phase will now be to apply some fluoride